Imagine for a moment that you are walking into a doctor's office, carrying the weight of your years, your memories, your struggles, and your victories, expecting that the person in front of you, the one in the white coat with the stethoscope and the medical degrees framed neatly on the wall, will see you as you are, a full human being with dignity, history, and value. You hope they will see the mother or father you once were, the hard worker, the dreamer, the neighbor, the friend. You hope they will respect the decades you've survived, the illnesses you've already overcome, the lessons you've gathered through time. But the truth is sobering. Many doctors don't see any of that when they look at you. What they often see instead is just a number, a birth year, a slowed gait, a wrinkled hand. They see elderly patient stamped invisibly on your forehead. And in that moment, something shifts in how they treat you. This is not something most doctors admit out loud, of course. They won't write it on your chart or tell you directly. But behind closed doors, in the way they make decisions, in the assumptions they quietly carry, lies a set of beliefs and biases that every older person deserves to know. These are the ugly truths that can shape your medical journey. Truths that may frustrate you, hurt you, and even rob you of the care you deserve, unless you understand them. Recognize them and prepare yourself to confront them. The first truth, and perhaps the most painful, is that doctors often see age before they see the person. Instead of asking, "Who is this human being sitting in front of me?" their minds jump straight to, "Here is an 80-year-old. Here is someone past their prime. Here is someone frail." They categorize you not by your individuality, but by your chronology. And once you have been reduced to a number, the richness of your life, the laughter you shared as a parent, the wisdom you earned through hardship, the countless contributions you made to family and society can be swept aside, as though they matter less than the ticking clock. This mindset is dangerous because it can lead to lazy diagnoses, to doctors overlooking real, treatable conditions and assuming that it's just old age. A pain in the chest might be dismissed as arthritis, when it could be something far more serious. Memory lapses might be brushed off as normal aging, when in fact they might signal something reversible. Seniors around the world tell the same story. The doctor didn't listen. They just assumed it was because I'm old. And that assumption robs people of health, dignity, and sometimes years of life they could still enjoy. The second ugly truth is even harsher. Many doctors quietly believe that treating seniors aggressively is pointless. They won't say this directly, but you can feel it in the way treatment options are presented. A younger patient with a heart condition might be offered surgery, medication, physical therapy, and counseling. An older patient with the exact same condition may hear only about comfort measures. Behind this lies a chilling calculation. Why spend resources on someone who might not have decades left? Why prescribe the newest, most advanced treatment to someone in their 80s when they could give it to someone in their 40s or 50s? It is as if the worth of your life is measured in years left, instead of moments still to live. Yet what those doctors forget is that every day matters. A grandmother who gains just one more year of clarity can watch her granddaughter graduate. A grandfather who receives the right treatment can spend another summer teaching his grandson how to fish. Life is not measured only in decades. It is measured in memories, in connections, in dignity. When doctors fall into the trap of thinking seniors are not worth the effort, they deny people the chance to live their final chapters with joy, with mobility, and with comfort. And this is not just about surgeries or high-tech treatments. It can be as simple as whether a doctor prescribes a proper therapy for pain, whether they take the time to explore a symptom fully, or whether they push an older patient toward palliative care long before it is necessary. The assumption that old people don't need much is a quiet cruelty. And too many seniors feel it when they hear phrases like, "At your age, it's not worth it," or "let's just keep you comfortable." Those words can sting because they reduce your value to a calculation, rather than acknowledging your humanity. The third ugly truth is about communication. Medicine is complicated. Doctors train for years to learn the language of anatomy, physiology, pharmacology, and diagnostics. But too often, when they sit across from an elderly patient, they forget that the person on the other side of the desk may not understand a word of this. They rush through explanations, use medical jargon, speak quickly, and assume comprehension. Seniors nod politely, often too embarrassed or overwhelmed to admit confusion, and walk out of appointments not truly understanding what was said. And the consequences can be devastating. Medications taken incorrectly, follow-up appointments missed, lifestyle changes ignored, not because seniors don't care, but because they were never really communicated with in a clear, compassionate way. Some doctors even adopt a dismissive tone, speaking as if to a child, leaving older patients feeling diminished. Instead of asking, "Do you understand this?" they assume you'll figure it out, or worse, that it doesn't matter if you don't. But it does matter. Every senior deserves to have their care explained patiently, step by step, in language that makes sense, with room for questions and time for answers. Yet in practice, many seniors walk away from their appointments feeling unheard, disrespected, and powerless. The frustration is immense. You want to take charge of your health, but the very people tasked with helping, you make it harder by not truly listening or communicating. And over time, this gap erodes trust. Patients stop asking questions, stop sharing their concerns, and resign themselves to silence, while doctors grow more and more detached. The fourth ugly truth is ageism itself. Ageism is not just a word thrown around in social conversations. It is real, and it seeps deeply into healthcare. Ageism is the belief, conscious or unconscious, that older people are inherently weaker, less capable, less deserving. Doctors who fall into this trap may withhold treatments not because the treatments are unsafe, but because they assume you can't handle it. They may avoid recommending physical therapy, exercise programs, or even surgeries that could improve your quality of life, because they have decided for you that you are too fragile. Imagine being told you shouldn't try to regain mobility when in fact you could. Imagine being denied opportunities to strengthen your body because someone else judged your potential through the lens of your birth date. This is the prison of ageism, and it can quietly strip years of independence from seniors. Many older people prove every day that strength, resilience, and vitality do not vanish with age. There are seniors who run marathons, who paint masterpieces, who learn new languages, who travel, who mentor, who inspire. Yet when ageism creeps into the decisions of doctors, these possibilities are cut off prematurely. And it isn't always overt. It can be as subtle as a dismissive smile when you mention wanting to improve your health, or a doctor brushing off your desire for treatment with, "Well, at your age," those words can crush hope. They reinforce the message that you are too old to dream, too old to try, too old to matter. But the truth is, as long as there is breath in your lungs and fire in your heart, you deserve the chance to live fully. Ageism denies that, and it must be named for what it is: a prejudice that poisons medicine. The fifth ugly truth is one many seniors feel most directly. Doctors simply don't spend enough time with older patients. Modern healthcare is built on speed, on moving from one patient to the next, on maximizing efficiency. But seniors often need more time, more questions to be answered, more explanations, more patience. Health is not simple when you've lived long. You may be managing multiple medications, juggling several conditions, trying to balance your health with your daily life. You need a doctor who will slow down, listen, and work with you. Yet too often you find yourself rushed. The doctor looks at their watch, interrupts your sentences, cuts off your concerns, and leaves you feeling as if you are just one more number on a checklist. And the tragedy is that in this rush, critical details get lost. A symptom that could have been caught early goes unnoticed.